This is Dr. Edward Gaber. These are my health maintenance recommendations. Please get a yearly physical. Also, you should see your primary care doctor every 3 or 4 months if you have a chronic condition. You should weigh yourself monthly, but weigh yourself daily if you have heart failure. Examine your entire skin, head to toe, for black moles and also new moles, as melanomas can be pink, and worse than melanoma is sebaceous cell cancer, which can be very benign looking. Women should self-examine their breasts monthly, and a doctor should examine the breasts of both men and women yearly. Get a mammogram yearly from age 40 to age 75, but continue to get them past 75 if you want to. Get an MRI of the breast every other year if you have dense breasts. If you've had X-ray treatments as a child to shrink tonsils, treat acne, or shrink a thymus gland, or radiation for cancer of the head or neck as a child, a doctor should feel your thyroid gland every 6 months for lumps. All women should get regular Pap tests and pelvic exams every 3 years, but every year if they have HPV, human papillomavirus. After age 70, no gynecological organization in the world recommends pelvic exams, but that is between you and your gynecologist. Rectal exams should be done yearly after age 38 by the gynecologist for women and by the primary care doctor or urologist for men. Stool cards for blood are often obtained yearly after age 35. Your first colonoscopy should be done at age 45 or much earlier if there's a family history of colon cancer or precancerous polyps in a first-degree relative, mother, father, sister, brother, or even a child. Men should self-examine their testicles for lumps every 3 months, especially between the ages of 20 and 40. See your eye doctor at least every 3 years to pick up early glaucoma, which can destroy your vision quickly without any warning. See your eye doctor yearly if you have diabetes. This is the most important thing I tell my diabetics. Check your blood pressure at least 3 times a year or daily if you have hypertension. I recommend the Rely On or Omron wrist monitor, which can be obtained on Amazon. Encourage your physician to get a complete blood count, a complete metabolic profile, cholesterol testing to include an apolipoprotein B, thyroid and A1C diabetes checks frequently. The hepatitis C screening is now recommended between the ages of 18 and 79 at least once. And after age 55, the coronary artery calcium score, which is a 30-second test in a CAT scanner without IV contrast, can be helpful in determining whether you have silent heart disease. If you have a high calcium score in this test, there's a 50-50 chance that you have coronary artery disease. And that tells your doctor to get your apolipoprotein B level below 80, and if more aggressive treatment is needed, below 60. After age 60, I do a yearly A1C and dihydrotestosterone-testosterone ratio blood test in men to pick up early pancreas cancer. Bone densities are indicated for women in menopause and for men over 70 to find osteoporosis. Carotid artery ultrasounds are done if a noise is heard in the carotid arteries, or if a doctor feels less pulsation in an artery, or if there any stroke-like symptoms such as blurry vision, trouble talking, or sensory or motor weakness. Carotid ultrasounds can also indirectly determine if there's cholesterol buildup in the coronary arteries. An abdominal ultrasound every 3 years can be valuable as it can pick up abdominal aneurysms, early kidney cancers, gallstones, liver, and sometimes pancreas problems. Fatty liver can progress to cirrhosis without drinking a drop of alcohol, so it's nice to know if you have a fatty liver. I believe you should get a yearly chest x-ray after age 50. No health organization in the world says this, but I do pick up early cancers not infrequently this way. These are my lifestyle recommendations. Remember, your chance of dying in an automobile wreck over the course of your life is about 1 in 80. So wear seat belts and do not speed. And remember, statistics still show that the heavier the car you're in, the more likely you are to survive a crash. So buy heavier cars. Wait 3 seconds after the light changes to green before proceeding, and look both ways, as people run red lights all the time. Do not drink or take sedating drugs before driving or using heavy machinery. Lock up your guns. Avoid raw seafood. Avoid eating a lot of tuna, mackerel, swordfish, or red snapper because of the mercury content. Eat many different colored vegetables, preferably organic vegetables, and eat a low-carb diet with a lot of fatty fish and low-carb yogurt. Use bug spray early mornings or evenings in the USA to avoid West Nile. And use bug spray day and night if you're traveling to tropical countries or Key Largo. As dengue, malaria, Zika are still rampant in the tropics, and there's evidence of dengue in Key Largo. Go to the cdc.gov/destinations site for further travel recommendations. Never ever swim in fresh water in Africa. Never ingest unpasteurized milk or goat cheese. Wear long sleeves and put your socks over your pants legs in tick-infested areas, including some northern beaches with tall grasses. Please stop smoking. Many free programs are available. Avoid alcohol completely with fatty liver. And generally, people should not drink over 2 drinks a day. Alcohol is bad for your liver, pancreas, brain, and heart muscle. Don't believe the alcohol industry propaganda. Alcohol is an oxidant, and it was shown recently that people who drink have smaller brains as they get older. Go to AA or NA or GA if you have an alcohol, drug, or gambling problem. If you are single, always practice safe sex. My immunization recommendations are quite detailed and on my website at medaryinstitute.org.